Hello, everyone. Welcome to Let's Talk Psychiatry. I am back. I am better. I am your host, Achima, and I'm here to continue on the series on Let's Talk Anxiety Disorders. Now, the last time I was here, we left off at agoraphobia, and today we're going to continue with anxiety disorders and talk about other types of anxiety. Now, I'm going to start with specific phobia. What is specific phobia? First of all, we have to know what phobia is in the first place. So, phobia is excessive fear of a specific object or situation. So, specific phobia is a fear of an object, a circumstance, or a situation. So, this fear is really strong. It's persistent. Persons with this disorder may anticipate the threats. For example, being bitten by a snake, and they might panic at the thought of losing control. So they're walking on the grass, they have that thought that a snake is going to come and bite them. Also, exposure to the phobic stimulus causes an intense anxiety. So, specific phobia has some genetic factors, it runs in the family. Usually, diagnosis requires having intense anxiety, even to the point of having a panic attack. Um, there are different types of specific phobia, and I'm going to just mention some few of them. So, we have acrophobia, which is the fear of heights. We have agoraphobia, we've talked about this, which is a fear of open spaces. Ailurophobia, which is fear of cats. Hydrophobia, fear of water. Claustrophobia, fear of closed spaces. We all know this. Cyanophobia, fear of dogs. Mesophobia, fear of germs and dirt. And we have pyrophobia, fear of fire. Xenophobia, fear of strangers. Zoophobia, which is fear of animals. Amaxophobia, fear of electromagnetic field and microwaves. Now, people with these kinds of phobias, they try to avoid this stimulus. For example, a person might take a bus from California to New York City or from Lagos to Kano rather than flying, just to avoid contacts with the objects, in this case, the airplane. So they have fear of flying and they rather take the bus. So, a way most patients or most people try to avoid this anxiety, you know, will be by going to substances, drugs, alcohol, and in the end, they might end up with a substance related disorder. Um, Depression can also be found in people like this. Okay? Treatment is usually exposure therapy, where the therapist desensitizes the person by gradually exposing the person to the phobic stimuli and have to teach the person some techniques to cope and deal with anxiety whenever it comes. So, techniques like relaxation techniques, breathing techniques, and so on and so forth. Another kind of anxiety is called social anxiety, also called social phobia. Now, this is a fear of social situations that usually involve contact with other people. So, people with this disorder have this fear of embarrassing themselves. They have fears of performing activities like eating in public or performing in front of people or acting or public speaking, presentation, you have to present something. So the anxiety here is that of embarrassment that may occur in the situation and not the situation itself, it's just embarrassment. So we have to differentiate this from shyness. People get shy, they overcome it. Social phobia anxiety tends to be seen in late childhood, early teens. Treatment, as usual, is psychotherapy and pharmacology. Uh, one of the one of the most important medication is propranolol for performance phobia, like public speaking. And of course, we have the SSRIs, benzodiazepines, and buspirone, which are first-line agents. Another type of anxiety is generalized anxiety disorder, which is excessive anxiety or worry about several things or events. It occurs for most days for at least 6 months period. So persons that have this, they're anxious about everything, almost everything. The worry is difficult to control. It's usually associated with somatic symptoms like muscle tension. They could get irritable, poor sleep, restlessness. The person is the classic warrior. The worry about everything. The worry is so excessive. That is really usually diagnosed by the person showing a pattern of frequent, persistent worry and anxiety that is out of proportion to the impact of the event that is the focus of the worry. So we have to differentiate this between the days are normal worry, and the word to differentiate it is excessive. It might interfere with a person's life, of course, for more days than not, for at least 3 months. Treatment, as usual, is therapeutic. We also have pharmacologic and supportive treatments. Now, other anxiety types, you can have anxiety due to a medical condition, like hypertension, diabetes, anxiety due to substances, which is substance induced anxiety from using drugs, alcohol, and we have mixed anxiety depressive disorder. So these anxiety disorders, yay, please note that the medical information that you hear from me right here is intended for review purposes only and not for diagnosis and treatment of any form of mental illness. So if you think you or anyone you know or love is suffering from any mental illness, please and please go and see your doctor or go and see your psychiatrist for attention. Okay? Thank you for watching. Let's pick a topic out next time. Email me, just email me your reply on the topic. We'll talk about that topic. What we do here is talk about mental illness. We have to break the stigma of mental illness and be more aware that illnesses like this can occur in people. So until next time, this is Let's Talk Psychiatry. I am Sochima, your host. I'll see you at the next video. Bye.